Back on MorningLine, thanks for joining us this morning. 1 year anniversary of the tornadoes that ripped through Middle Tennessee, and a lot of folks still struggling to deal with the trauma of that. And on top of that, COVID-19. And this morning we're talking with two folks from Mental Health America. Mid-South CEO Tom Starling, Karen Carruthers is there with the Zero Suicide Initiative. Thank you both for coming on with us. And we have a caller that waited through the break, so let's take Joe real quick, and then we'll continue our conversation, see if we can help him. Good morning, Joe. Hi, Joe.
Hey.
Good morning to you, Joe.
Well, I just listened to your guest, but it seems like to me that everybody's under pressure. People driving on the interstate, if you cut them off, or they say you cut them off. You go into a parking lot, let's say got my parking place, and you can't get metro government, state government, even the federal government. You can't get through to none of these people to talk to anybody. If you call the mayor's office, you get some person, and they're always this, they get a recording. I'm away from my desk. If you leave your name and number, I will return your call, which never happens. And as far as the mental health end of it, it seems like to me the worst call that the police department gets and is somebody that's on drugs, or the family says they've got mental problems, and then something bad happens. They blame it on the police department. Mm-hmm. They don't. They know these people got problems, drug problems, or mental problems, or whatever, but they don't do anything about it. So when they call the police department, they dump it in their laps. And when you go, then you get something bad happens. They say, well, he had mental health problems.
Yeah, I'll tell you. And Joe, thank you for the call. Hey, Joe touched on a bunch of points there, Tom and Karen, if you want to comment on it. But the one issue there with regard to the mental health issues and responding to it and the availability of beds. I don't know if you both are familiar with Davidson County Sheriff Darren Hall just built this new jail, or the city, of course, did, right downtown. And you know what I'm talking about. There is a whole section in the back there dedicated for mental health treatment, because the sheriff says 99.9% of everyone incarcerated there in the county jail either has a mental illness or a drug issue. And usually those two are linked, because I think you guys can comment on this as well. A lot of folks self-medicate. Go ahead, Tom.
Yeah, I was going to ask Karen the same thing, if I could take this one. You know, that's exactly what we do find. Joe was right. We find a lot of people who are stressed out. Granted, we live in a state, everybody's a little overweight. It's a tobacco state. We're living some unhealthy lifestyles, and then you start trying to cope with your stress and anxiety and depression by using drugs, drinking more. Well, then you develop a co-occurring disorder, kind of a dual diagnosis with a mental illness, anxiety or depression. Sure. And an addiction. And so it kind of spins out of control. And then, I would just say use healthy coping strategies. And a lot of that's relationships and socialization. Secondly, I really do want to applaud law enforcement in the Middle Tennessee area. Sheriff Hall and so many others are so dead set on getting people the right help at the right time. And I wish I knew why we should be calling an ambulance, but sometimes we call the police when people might have some odd behaviors. And when people are incarcerated, police and correction officers are not psychologists or social workers. And his department, the sheriff department and the police department here in town, are so great about diverting people from incarceration over to treatment and recovery, places like the Mental Health Cooperative, Centerstone, what the sheriff is doing with his jail. Tennessee, especially Nashville, is just such a great place when it comes to helping these individuals with recovery and treatment instead of incarceration. And of course, sometimes if a crime's committed, you are incarcerated, but that pre-arrest diversion program is excellent.
Yeah, Karen, I was wondering, Tom just said the key sometimes is having the help available at the right time in the right place, hopefully before someone gets arrested or the police have to be called. So how do you know if you're dealing with a loved one or a friend when that right time is to act?
Probably the best time to, if it's a family member, then you know the person well enough to know that the person is behaving in a way that's not normal or usual for them, and so you're able to identify that fairly quickly, and so you would then want to be able to get help immediately at that time, and certainly not wait until the situation escalates to the point that you may have to take some additional measures. As Tom was talking, I was thinking, I thought he was going to maybe talk a little bit about the mental health training that we do for first responders, as he was talking about how well our police officers and our police department are responding. We're providing training as well because they're so committed to this effort that they want to know what those warning signs are so that when they get there, they can actually support the person better and intervene in a way that's more appropriate for the situation. And I don't know if Tom wants to talk a little bit more about that training or not.
Yeah, go ahead, Tom. I mean, you're talking about the training for the law enforcement officers or others that respond to some of these calls at times. I would think anything if they can find a way to do it as opposed to arresting someone, realizing they need mental health treatment and getting them that help instead. But then it just comes to so many times I cover stories where crimes are committed and then the public on Facebook with me and everything, well, that person needed help, or get them mental. You and I both know there are not enough mental health beds in this city or anywhere. It's not like, oh, we have all these resources, bring them in, and we've got a team of doctors ready to evaluate them. There's just not enough of that to go around, unfortunately. So a lot of people end up just in a cell.
Yeah, you're right. And, it's what Karen said. Early is better. And if you could do prevention or early intervention, that's one reason that our mantra is before stage 4. You would never wait till stage 4 cancer to say, well, now I can finally start my treatments. But for some reason, we have this chronic illness called mental illness, and this chronic disease. And the threshold for getting help is that you're going to harm yourself or others, which is really unfair. And then people look back after somebody's attempted suicide or they're incarcerated and they say, oh, we all saw this. We just didn't know how and where to get help before stage 4. And we do provide free training. It's an 8-hour class for first responders, EMTs, firefighters, police, security guards, airport police, just a variety of first responders. We provide an 8-hour course called Mental Health First Aid, and it's evidence-based, and it's really great. And the great part is, number one, we are helping people that are stressed out or maybe they're having their first episode of psychosis. They don't, know how to help themselves. Their reality is a little different, but we're also saving lives of police officers and first responders because they can't go into every crisis saying, I've got to be prepared to act one way, when really what it is somebody is sick, somebody is ill. It's a mental health crisis, not a safety crisis per se. So this training really is great, and that's just one of many trainings we do for the community when it comes to mental health.
Okay, and yeah, you mentioned, I have to ask you this then, I'm sure some people are wondering, so you say stage 4, you don't want to wait till that long. Are there actually clearly articulated 3 stages before that, or you just mean stage 4 is as bad as it gets? But what are the other stages? Like what for instance, is stage 1?
Yeah, a lot of times what I just talk about is prevention, early intervention, maybe integrated treatment of treating both the person physically and mentally. But when I refer to stage 4, I'm talking about some stage 4 symptoms like incarceration, expensive hospitalization, a suicide attempt, things that, we clearly saw a buildup, but we didn't know how to intervene. We didn't know how to ask the question. If somebody is distressed or disturbed, we say, well, you're not thinking about doing something stupid, are you? And that is so much the wrong way to ask that question. And that's what Karen goes out to teach.
That's what I wanted to get to next then, Karen. So, I mean, if you can give us a breakdown, all right, how to ask the questions and then how to go about making a referral when you're dealing with someone. Because, yeah, that question you just said, Tom, to me is pretty clear. Yeah, you don't want to use that approach. So, Karen, tell us, so what kind of questions, how do you go about doing it then where you can determine and then maybe convince an unwilling friend or loved one that, yeah, let's make a call or get a referral and see if we can get some help. Walk us through that process and do it as though, you know, give me an example.
Well, one of the trainings that we teach it's called QPR, and the QPR stands for question, persuade, and refer. So you're going to ask the person, of course, specifically about suicide or their thoughts about it, and you're going to persuade them, of course, to get some help, and then you're going to refer them to the appropriate resource. So that's important. And you think of QPR just like you think of CPR. It's sort of the CPR for suicide prevention. So it's just simple 3 steps. Anyone can do it.
Okay. Hold on.
Trained.
Okay, so, all right, I love hearing it explained. I want you to question me now. All right, let's pretend you're concerned with me, and I want you to do it as though you're doing this with one of the people that you deal with on a daily basis. I want to give people an example. It's one thing to talk about the procedure. It's another to actually show them. So I'm really blue, and you've noticed that I'm not my normal self, all right? And Karen's a good friend of mine, and so she's reaching out. How do you start asking me some questions?
Okay. So I've noticed lately that you seem really sad.
Yeah.
Tell me what's going on. What's happening?
I don't feel myself. I just feel I wake up in the morning and I don't want to get out of bed, and I'm not sure exactly why. I don't really want to talk about it. Okay.
It sounds like there's a lot on your mind. So do you sometimes, when people are really, really unhappy, and I've noticed, we've seen each other quite a bit lately. Sometimes when people are really unhappy, like you seem to be right now, they wish they could go to sleep and never wake up. Do you feel that way?
Sometimes maybe I feel that way. Other times not so much. I just feel a little hopeless at times, and I just wish I could feel better.
Okay, so have you been so unhappy lately that you've been thinking about ending your life?
Okay, good. And listen, I'm going to cut it off there because I don't want someone tuning in thinking that this is anything other than a dramatization. But Karen, those are great examples. That's wonderful. And I can see how she gently questions. And I guess as you evolve through that questioning with someone, eventually maybe you get to the determination, yeah, indeed, all right, yeah, Nick does need some help. And then is that then where you, with them, make the phone call? Or do you ask them to say, hey, listen, I have a number you should call? Or how do you convince them then, Karen, to seek that help that maybe you think they need?
Well, it's important that you stay with them through the process.
Okay.
So, when you're persuading, you want to make sure you let them know that you care about them, you're concerned, and it's difficult, but you're going to work with them, you're going to be there with them through the process, and then, you say, well, together we might get some help. And then you say, I'd like to call someone to get some help. Can we call the suicide helplines? You can talk to someone right now. Is that okay? And hopefully the person is going to allow you to talk with or dial the number so that they can actually talk with someone. And, you may even tell the person, let's look at trying to get you an appointment to actually see someone. And if I have to take you, I'll go with you.
I think
awesome.
the big key is you don't say, hey, you need a psychiatrist. Instead you say, hey, will you go with me to get some help for you? To kind of make sure that person knows you're going to chaperone them. Can you go with me to get some help for you? And make it more, on you, and that they have somebody that they can trust. And but that's excellent, Karen. That's exactly. And don't be afraid to say the S word. It's not sex. That's another S word. But suicide. Just go ahead and say it. Hey, are we talking about suicide here? I mean, get it out in the open, because that person, it will be a relief to them.
Yeah, it's interesting you say that, because I think, and I've been in a situation like that where I've tried to help someone in the past, and in my mind I wasn't sure necessarily the way, and it worked itself out, but that, do I use the word suicide? Because that's what I was worried about. That's what I was thinking about. And you worry that if you bring that up, it's like maybe in your head you're thinking, well, that hasn't occurred to them, and by me bringing it up, they might think about that, you know? But you say, you know, pick up on the signals. And you can address that and say, is this something, just say, are you considering this, right? And take it head on is okay.
Absolutely. Yeah. Don't be afraid to use that, because if they're not thinking about it, they'll say, well, no, but they'll know that they can come back to you if it gets to that point. If they say, yeah, I really have been thinking about it, then you want to know if they have a plan. And if they have a plan, you know you're kind of dealing then with an emergency type of situation, that maybe you've stopped this person, maybe you've saved a life. And it's this QPR training that Karen does. It takes an hour, and to think that you could save a life just like you could with CPR. It's a great training.
Absolutely. Listen, we'll take a break on that note. When we come back, we may take a few more phone calls. Also, we have some folks following us on Facebook as well at newschannel5.com. One individual asking if we would talk a little bit about the issue of mental illness and depression and homelessness. And I think that's a big portion of our homeless population here that could use some help on that regard. So we'll get into that with our guests and more with you right after this. Stay with us.